Please bring in all medications in the original boxes in the green pharmacy bag, which will be provided. We also ask for well-fitted, non-slip footwear or slippers, wash bag and contents, the pre-op skin wash, which will be provided by the hospital, pyjamas and a nightgown. Additional pyjamas they can be bringing from day 2 after the surgery, glasses, hearing aids, walking aids such as walking sticks or frames. Mobile phones can be used in designated areas on the ward, but they can't be used in intensive care or the high dependency. Please don't bring towels and washcloths. They'll be provided by the hospital, and this is for infection control reasons. Please don't bring valuables and large amounts of money. There will be a trolley that comes around the ward and you'll only just need a little bit of change for that. Jewellery and watches. Wedding rings can be worn but will be covered with tape prior to theatre. Visiting times. Ward 31 and high dependency unit are 3 till 8. Intensive care is 1:30 till 7:30. 2 visitors to a bed space only please, and this is for infection control reasons and access to the patients in an emergency. Visitors are allowed to sit in the day room and alternate visit in the bed space. Patients can also sit in the day room when they're feeling well and have more visitors. Children under 5 years old are not allowed in the ward area. Telephone numbers for Ward 31, high dependency and intensive care will be provided. If you could ask just to please nominate 1 to 2 people for phone inquiries to limit the amount of phone calls that the ward area receives. Brief information will be discussed over the phone regarding patient progress. More information can be given face to face. If you are coming into hospital on the day of surgery and you live a distance away from hospital, you can arrange local accommodation for the night before. The hospital does have a limited number of single rooms available for a small fee. Please see the contact number. A relative can also stay in the accommodation if you live a distance away whilst you are in hospital. Please arrange your own transport to and from the hospital. You'll be able to travel in a car, an ambulance is not required. Taxis are suitable to be arranged by yourself to take you home. Due to strict guidance with the hospital, we are unable to provide transport for patients unless they fit a certain criteria. Please identify means of transport prior to admission to hospital. Please inform the staff on the ward if you have any specific dietary requirements which we can cater for, such as halal, gluten or lactose free. We are unable to heat up food brought into the hospital. On the day of surgery, you will be met by the nurse who will look after you. You will have a shave and then you'll be having a shower with the skin preparation wash. You'll use the nasal cream provided. You'll have a theatre gown on. Your theatre checklist will be completed. You'll have also been fasted as per anaesthetist request. And you can wear your teeth, glasses, hearing aids. These can be worn to theatre but will be removed in the anaesthetic room. Post-surgery on the ward, you will be reviewed daily by doctors. Your wounds will be reviewed daily by the nurses. Assistance will be provided with washing and dressing by the staff on the ward. We do ask that you wear the surgical stockings and they are worn until discharge home. Patients are discharged home 3 to 10 days after surgery. On average, this tends to be day 5. Please identify who can help you at home after your surgery. This can be family, friends and neighbours. There are a limited amount of services available in the community, so please explore all options of assistance for discharge. Upon discharge, you will be mobile and able to attend hygiene needs. Therefore, help will be required with shopping, meal preparation and housework. Patients are discharged home over the weekend and after 6, but we do advise patients do not go home late at night. If you do require assistance on discharge, please inform nurse and staff on the ward so this can be arranged. You could be discharged home on a weekend or after 6. We do have a discharge lounge within the hospital, and this is designated and cared for by nurses. You may be asked to wait in the discharge lounge whilst waiting for medication or transport home. Sick notes will be provided upon request. Your GP will be notified of your discharge from hospital and any medication changes. You'll be supplied with medication on discharge, which the nurses will explain in detail to you and your family. The ward operates a post-discharge drop-in clinic for any non-urgent inquiries. It's available Monday to Friday, 9 to 5, and you're welcome to contact the ward at any point.